Hi, this is the YouTube for lab prep for body mechanics, mobility, hygiene, range of motion, and the use of anti-embolism stockings. Blackboard Prep is your handout, which is in Blackboard. Please take a look at that. It gives you all the information you need in order to prepare for your lab. There is a PowerPoint available if you wish to print it out of this YouTube, and there are Mosby's videos and review questions that need to be done prior to the lab. Universal steps for all procedures. If you take a peek inside your Wilkins and Treese Volume 2, Fundamentals of Nursing, you'll see a list of what you need to do for all procedures. And now we're starting doing more procedures. I want you to kind of commit this to memory. What do you have to do for a procedure before approaching a patient? How do you prepare the patient for the procedure? What are you doing during, and what do you do after? These are classic items that need to be done prior to any procedure that you'll be doing. So please commit these to memory and practice them. Learning outcomes. Straightforward. We're going to review body mechanics. That's probably one of the most important things that you're going to do in this lab. And then we're going to actually use wheelchairs, walkers, canes. We're going to be moving people in beds. We are going to do perineal care on males and female mannequins. That's something that we didn't do in our first lab. And we're going to perform range of motion exercises on each other. And also the anti-embolism stockings, or some people call them TED stockings, T-E-D. You're going to measure and correctly fit and apply your partner's stocking on your partner's legs. So you will learn how to put them on and take them off on each other. Ergonomic challenge. I found this and I really like this because our business is all about working with people and working with the human body. And this, I think, is very apropos. The adult human form is an awkward burden to lift or carry, weighing 200 pounds or more, and has no handles. It's not rigid, susceptible to severe damage if mishandled or dropped. And that's the human body. That's what our business is. Our patients, sometimes they cannot help. And how is it that we can move them safely and keep you safe at the same time when it's a very difficult form to lift or carry? Why learn about proper body mechanics? I think the basic thing is we need to keep you safe, and we need to keep your patients safe. And if you hurt your back, or you may hurt your patient if you're not moving them safely, you place less strain on your body and stress on your body to prevent injuries. And this is something, it's a lifelong career. You'll be working with your body for a lifelong career. So I know nurses that have actually shortened their career. They've hurt their back and were unable to work afterwards and had to go on disability. So please, this is a very serious thing that we're doing in this lab, and do not take it lightly. Also, you'll be working pretty hard if you're working on units and that sort of thing. So we need to conserve your energy, and using proper body mechanics will help that. You need good alignment. You can see the schematic on the right, how well the person is standing up straight. You need to have balance, you need to have coordination, and you need joint mobility in order to do transfers and that sort of thing well. 4 items to remember. Keep your feet apart. A wide base of support will keep you be able to lift much better and keep you much more solid when you're lifting someone. Bend at the knees and keep your back straight. Excuse me. And when you do this, you're actually using your thighs to lift, and you're not lifting with your back, and it really makes a difference. Keep the object or weight close to you. If you're picking up a box or something heavy, keep it just as close to your chest as you can, because if you have it out, it tilts your balance, it puts strain on your back, so bring it in close to your body. And the other one is keep feet in the direction of the weight that you're moving. So if you stand a patient and you're stand pivoting them to a chair, you're going to be moving your feet along with the patient so your back doesn't twist. Very important that you do not twist your back. That's when you get hurt. So basic principles of moving a patient. You can see here in the schematic we've got 3 nurses that are turning a patient that doesn't look like they can help much at all. There usually is a leader on this when we do this, and that leader needs to be clear and consistent. And remember, when you give directions on moving someone, there's a person there, and that person can hear. Even if they don't hear, you need to treat them such as they can hear you. And you'll make for a much better, quicker turn, bed change, whatever it is that you're doing, and get it done quickly and correctly. Terminology. You all know that I am a stickler when it comes to using correct terminology. So here's some words. These are basic positions of someone in bed. The first on the upper left is prone. And excuse me, it's supine. I don't know why I said that. Supine has the words up in it, so that's how I keep to remember that supine is up and prone is down. So facing up and facing down, prone and supine. The lower left is a Fowler's position, where they actually have their head up 45 degrees or so, and that can be adjusted. On the right upper right hand side, this is a lateral position, and this one happens to be a right lateral position. They're on their right side, and you just see the use of pillows here. And the one below it is a Sims position, S-I-M-S, and you can see the use of pillows here. The difference, if you look closely between the two positions, is the rotation of the shoulders and the hips. So you can see this one is much further out. Some people actually like to sleep like this. It's also a good position in order to give enemas, Fleet's enemas, that sort of thing. So we use positions for certain reasons. And again, my pet peeve, I know you've seen this before, but I'm going to say it again. People have the right to be clean and stay clean if they are unable to do it. So I just want to say, get used to it, get over it, and get on with it and do it. We will be practicing actually doing pericare on mannequins in the lab. There is a correct way to do it, and it needs to be done, because if they can't do it themselves, we need to do it, because number one, it decreases odor. It also will decrease a moist area. Moisture breeds bacteria. Bacteria breeds infections. So there's reasons to do this, absolutely. So how's bed making a procedure different than what you do at home? You think about it. We don't just flop the stuff on the bed, and I know you've been making beds all semester long, but I really want to hone you in on what it is that you do differently in the hospital. Don't shake the linens. What you're shaking is you're moving the air. There may be micro portions of the linen in the air that may impair someone's breathing, so you have to be very careful. You don't shake it. If there's anything on it, we don't want that going anywhere. You put pillowcases on differently. At home, we just slam the pillow in and shake, 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 that sort of stuff. Again, you don't want to shake the linens, and you can learn how to put the pillowcases on correctly. You don't put the linens on the floor. The floor is very filthy. I always consider floors filthy, so you need to take it and put it in the linen hamper right away. Oh, and the hospital bed, remember, can be elevated for your back, or whatever facility that you're in. A lot of times they have electric beds. Do that and save your back. We miter the sheet corners in order to, and I do that, maybe it's a little old-fashioned, but you want your patient to look and feel cared for. You want family members to come into a room and not see a real sloppy bed. So if you make it, and you make it well in the beginning, they know that I get a good nurse taking care of me. This person cares. So it also makes it much easier when you're working with the sheets on the bed. And avoid touching your uniform with a linen. So that's one thing. They're not that heavy, but hold them. This is one time you would hold them out from your body when you gather them up and put them into the laundry hamper. If you want to wear gloves doing this, this is your choice. You don't have to, depending on what's going on with the patient and what's going on in bed. We also use draw sheets, and those are half sheets or smaller sheets that help us move patients in bed, and we will be doing that in the lab. So, key points when you're doing the bed making: you use precautions to prevent the spread of infection. So you may have to have your gown, gloves, and that sort of thing on. You need to wash your hands before and after procedure. Hold the linens away, as I said, and you may wish to wear gloves. A little ahead of myself there. As far as mobility is concerned, here are some orders. Up ad lib, that means up as they want to be, out of bed to chair. You can read these: bed rest, except for bathroom privileges. These are typical orders that you may have as far as activities concerned. So people just can't get up and go, especially if they've had some surgeries or they've fallen. Please make sure that you understand what those mobility orders are. We see people in bed in our business, and that's why we want to prevent complications. If you're in bed, your blood return slows tremendously. That's why people get swelling, or they can get edema. They don't expand their lungs very well. That's why the semi-Fowler's position, you have them supine with their head up a little bit. It's better than being prone, right? We will do passive range of motions because that increases circulation, and it also helps prevent losing motion in your joints. Prevent orthostatic hypotension by having the person get up slowly, and especially as they're older, this is something that's much more common. Have them sit on the side of the bed for a few minutes before they get up. And if your patient is in bed, make sure you turn them frequently. Usually it's every 2 hours, to prevent any type of what we call beds. They used to be called bed sores. Now I can't remember what they're called now. But anyway, you pressure points. You don't want, and they can skin breakdown. That's it. You don't want to have any skin breakdown on your patients. And lastly, here are mechanical lifts. In your facilities, you're probably going to use some type of these. This older one on the left is something that I used when I was a nursing student. And you can see this one on the right. This is something that's actually built into the ceiling, and a lot of places now have these lifts built in the ceiling. So you can actually move a quadriplegic, a paraplegic, somebody that is unable to move themselves, and you can get them into bed and into a chair, move them from bed to chair to stretcher or whatever. The only comment I have on all these pictures is you want to make sure that there are 2 people working these lifts at all times. You don't do that by yourself. So this is the end of the prep for the mobility lab. If you have any questions, please email me, or I'll see you in the lab. Thank you.